My group, which is the cellular imaging section, is in the Institute for Cell Engineering, which originally was developed to develop cell therapies for treatment of degenerative diseases in patients, primarily using stem cells. And my group is literally engineering cells, manipulating them, either by putting nanoparticles in there or contrast agents, or reporter genes, existing and novel ones that we are developing, for instance for MRI. And the whole goal of our group is to help to facilitate the transition of these therapies that have been shown to work in animals into patients. One of the main things, I think, is to assure that these cells don't form tumors. Right? That's a major concern, and even if only one cell out of 1 million doesn't differentiate, it can still pop up and come back as a tumor, and only with imaging, because you don't know where these tumors may grow once you give these cells, you can do a whole scan of a whole individual, and then you're able to assure the safety of these transplants. It is very useful to have a technique that is non-invasive, so you can image the same animal multiple times. Because right now it's a static viewpoint, you sacrifice a cohort of mice at day X or week X or blah blah blah, and there are a lot of situations where the disease is very variable, for instance multiple sclerosis, a very variable course. And only when you follow the fate and the dynamics of your cells within the same individual that has this variable disease, then you can really understand what happens with these cells.